How's it going? I haven't shown these sequences, the individual movements in the sequences for a while, and I haven't shown this particular sequence ever, I don't think, on YouTube. I made this sequence up while working with someone who's a chronic pain client, lots of arthritis and other kinds of things going on. And I've had to do different versions of it over the years. This version that I'm showing now is a particularly easy one, and I think it's a good thing to have an easy sequence up. And then after that, I'll show a more difficult exercise as well, just to complete this little short. Okay, so first, warming up the muscles of the abdomen, really small and quick, side to side, windshield wipers. So it's not a stretch, it's to work these muscles here. Okay, next. On your side. With her, I give her a pillow here. And it should be fairly stout because she has a lot of issues with her neck. Slide the right foot down the mat. Point the foot off the floor and stay. And notice I'm really lengthening through that leg. It's at what I call the hip line position. It's slightly above. This is the line of the greater trochanter. It's just a little bit above that to really get all these gluteal muscles firing. So first, it's pointed, very straight leg, and then flex and a full flex. I contract all the gluteal muscles and also the stop P muscle, the muscle you use to stop urination. And then bring the knees together. Now, typically at the beginning, we only do that once or twice. As things progress, you do 4 repetitions of just that. So once more, slide the right foot down the mat, point off the floor, and stay. Flex. Gluteal muscles and SP, and knees together. And one thing about that, and that exercise in particular, is it emphasizes an isometric contraction. And so what it turned out with this particular client is at a certain point I had to lessen the amount of time she was holding that. It got to be too much. To make it more difficult, hold the contraction, the isometric contraction, longer. Okay, next exercise. Slide the right foot down the mat, point off the floor, reach to the hip line, flex, swing the foot forward, bring it up to the ceiling, reach it forward, point and bring it back to the hip line, and knees together. And so when you're up for a little more vigorous, or your client is up for something a little more vigorous, I do it the following way. Notice also this hand is positioned very intentionally in front, because a lot of times clients will end up back here. We want to keep your weight over this hand, not so it's collapsed, but so you're stacked straight up and down between the two sides of your pelvis here. So slide the right leg down the mat, point off the floor to the hip line, flex, and now you got to swing it forward. And here, just repeat this. Up, slow down. Up, so it's a quick movement here, and then slowly down. Up, slowly forward. Up, slowly forward. Point and bring it back to the hip line. And knees together. So, if it's too much to do that second version, just do the first version until your muscles get primed for it. Next thing. This one adds some extension to the mix. So we have slide the right foot down the mat, point off the floor to the hip line, flex, reach the leg way behind you. As you reach the right arm forward, point, and SP. You breathe into this big arch. And knees together. That really works the back muscles a lot, so if you're having a lot of trouble here, be a little easy with that. Eventually, that becomes a lot of the solution. Is getting your body able to move in this plane and developing the muscles of the back more. Okay, next exercise. Bring the knee up towards the nose. Exhale. Inhale and reach. Got a little extension, and that's okay. Exhale, rounding the spine. Exhale. Inhale, reach. And you continue 1 time, 2 times, 4 times, whatever, riding the breath. Use the breath to move your whole spine and hips. Exhale, rounding, flexion. Inhale, arching, extension. Okay, next exercise. Get rid of the pillow. Bring that right knee over the left. And this is called the snail foot. And so what I've been doing lately with this client is starting again small and quick. And then big and relaxed. Okay. And that's that nice quick floor sequence there. Okay, thank you.